Okay. Hi, everybody. My name is Dr. Lindsay Wilkinson, and I'm here today with one of my amazing colleagues in Portland, Oregon, Dr. Crane Holmes. And so this is going to be the first interview in my monthly newsletter that I'm working on. And we're really going to focus on SIBO, GI, all things SIBO testing today, because that's Dr. Crane's area of expertise. So I'm just going to turn it over to him really quick and let him introduce himself. And we just would love to hear, like, why SIBO, why the GI, why is this your specialty?
Yeah, totally. So I'm Dr. Crane Holmes. So I have a private practice here in Portland, Oregon. And so my practice is, I would say, 99% SIBO, or small intestine bacterial overgrowth. I really become interested in this with, a lot of the patients I was seeing even through medical school and through my residency that had these long-term digestive complaints and just like weren't getting better, right? And, with that, they may have skin conditions like different rashes or migraine headaches or urinary tract problems or pelvic problems. And I was like, there must be something we could do for these people. And, that's where I learned about all the dysfunction that the GI tract can cause. And, the exciting part for me is we're really just at the tip of the iceberg right now to understand what's going on in the GI tract. And I enjoy that part of it.
It's so true. And I think, I'm not sure 100%, you'll have to correct me on this, but I think we both did Dr. Steven Sandberg Lewis's mentorship for SIBO during
Correct.
school.
Mm-hmm.
Yeah, and so that's a year-long program where all he does is SIBO. He's our SIBO guru in Portland and really in the nation. He's an amazing practitioner and just knows so much. And so I sort of fell into SIBO during school when I was just interested in the GI tract and what else I could do to help my women's health practice. And so that's where I came into it. And oh my gosh, that year of training, I learned so much, and I had no idea how much I'd be using it in my actual practice. And so
Mm-hmm.
after I graduated, I did my residency, and boom, I started using SIBO right away because the symptoms just fit for so many people. In my practice, because it's a lot of hormone health, women's health, digestive disturbances, I see women with abdominal bloating, chronic pelvic pain, painful cycles, the acne, some of the skin manifestations that Dr. Holmes was talking about. So since that time, I've just been really connecting with practitioners who have a complementary practice to that. And one of the amazing things about Dr. Holmes is that he just recently purchased a lactulose breath test machine. So he can do that test here in Portland. And he's really an expert at doing the test and interpreting it accurately, which is so important when you're doing SIBO. So I'd love to hear a little bit about, like, why is the breath test the best way to test for SIBO and the best way to see what's going on in the small intestine?
Totally. So, like you mentioned, the test is a lactulose breath test, and this lactulose is a sugar, just like maple syrup or white sugar or whatever else it may be. And we drink the sugar to perform the lactulose breath test, and our intestines do not absorb the sugar. But the bacteria in our intestines love the sugar. So we drink this sugary solution, it slides down all our intestines, and the bacteria just gobbles up all the sugar, just loves it. And then when it's gobbling up all the sugar, it releases gases. The bacteria releases both hydrogen and methane gases. And through these convoluted ways, the gas gets from our intestines into our lungs, and then we breathe it out, and that's what we're collecting in vials. And then we do a collection every 20 minutes for 3 hours so that we can track that lactulose as it travels from the mouth through the small intestine into the large intestine.
And why can't you use any other kind of imaging or test to really see what's going on in the small intestine? Why does it have to be this test?
Mm-hmm. The small intestine is kind of like a secret cave. When we think about, like, a lot of people think about, like, oh, what about a scope, right? Like, what about an upper scope or a lower scope? Well, when we do an upper scope, we really can only get into the small intestine about 6 inches. And when we do a lower scope or a colonoscopy, we can only get into the small intestine about 6 or 8 inches. And the small intestine is 28 feet long. So we really don't know what's going on in the whole rest of it, right? And then with the imaging, again, we can't really see like bacterial levels or yeast levels or, what kind of enzymes are in there or whatever else it is on just basic imaging, where that's really just looking at structural abnormalities.
Yeah, and I'm glad you brought that up too, because I have a lot of patients who come in and they say, I've been treated for chronic yeast overgrowth in the GI tract before. It helped for a while, but it hasn't helped me since then. Like, what's going on? So why is the methane and hydrogen, what's the overlap in terms of symptoms for yeast versus SIBO?
Yeah, so when we think about purely hydrogen and methane, we think about hydrogen gases being more correlated to being released from bacteria in the GI tract. And we think about methane being released from these things called archaea. So they aren't actually bacteria or yeast. They're ancient organisms that have been around like as long as the dinosaurs. And they are not in every single person. So it's not every single person that actually has methane gases in their intestines. I will say there's no evidence, to say that yeast overgrowth causes methane levels in the intestines. But I would say in a lot of my patient population that maybe we've tried treating the archaea and we've tried treating the bacteria, and they still have this methane picture and still have this constipation. I'm finding that doing either further investigation for yeast overgrowth or actually just treating yeast overgrowth has been pretty successful.
Yeah, I agree. I think that it's really, there's no one size fits all. If there's an overgrowth of bacteria in the small intestine, more than likely there's inflammation that can lead to a yeast overgrowth as well. So often we're treating multiple things, and this can happen over time too, where we do some treatment, things are better for a while, and then come back around and see it in a little slightly different way. But in my experience, and I'd love to hear your take on this, that the symptoms of SIBO and yeast overgrowth can be very similar. So bloating, a lot of patients have the sort of wastebasket diagnosis of IBS, which is they go to a GI doctor and they do some testing, maybe they do some imaging, and they just get diagnosed with IBS and say, manage it with your diet or manage it with stress. But those symptoms are very real, especially abdominal pain and discomfort. Obviously IBS can be constipation or diarrhea or a mixed picture. And then that bloating really is a sticky point for a lot of my patients. Is that kind of what you're seeing too?
Definitely, 100%. I mean, I can just think about a patient I just saw yesterday who, again, she eats a really clean diet. She's really mindful of her stress. We've tried so many different bacterial overgrowth treatments, and we started on a yeast treatment. And in a month, she's like 70% her bloating and 70% her belching has gone down. So that's awesome, and that feels like definitely a win for us. And, one question I know that you're asking a lot of your patients, and I'm thinking about, and a lot of our patients are aware of, is, maybe this could be related to antibiotic use, right? Like maybe I haven't been right since I had those 2 urinary tract infections back to back, or whatever it may be. And the way that I like to think about it, and I explain to patients, is, antibiotics do a really good job killing bacteria, but the yeast, it does nothing, right? So all of a sudden now, all of our bacteria that kind of keeps our yeast in check is gone, and the yeast is like, well, I got all this room to grow, like I might as well grow, and I got food and I got everything else, let's party. So I do see that being a big part of a lot of people's pictures.
So true. It's so true. They just have a party because all of the good bacteria that maybe you came into this world with, or that your GI was unaffected as a kiddo, you add on antibiotics for earaches, you add on antibiotics for sore throats, you add it on for UTIs and lots of other things that come up, bronchitis, colds, flus, things like that. And all of a sudden your good bacteria are just, there's just, the numbers just aren't there. And so the yeast can overgrow, they're having a party, and they're creating all of that gas. And so both bacteria and yeast can be responsible for that bloating. But I also see patients with like kind of weird, vague heartburn symptoms, or a lot of belching and gas coming up that way. Sometimes people are passing a lot of gas and they're like, it was never like this before. My diet's exactly the same. So these are really 2 good places to look into. And, with treating SIBO, like what would you say is the best time to retest, or how long do you wait in between cycles of SIBO treatment? Talk us through that a little bit.
Yeah, so one thing I actually commonly say with my patients is I treat people, I don't treat test results, right? So, and it's ironic because I own the testing lab and I do test results, and it's part of what I do, but I really like to emphasize that I treat people, I don't treat test results, because I've actually seen where people, 2 sides. One, people feel amazing, right? You do the treatments, they feel great, they're be able to expand their diet, they're able to eat all these things, and we repeat a breath test, and then maybe it's higher, or maybe it's worse than the original one says. And then, so it's that question of like, well, do we keep treating? And it's like, well, you feel good, right? And that's ultimately what I care about, is people to feel good. So, a general rule of thumb when you're thinking about retesting after treatment, the times I use it most commonly are with maybe people that are doing elemental diets. So we're trying to understand if we want to do another week of elemental diet after doing a 2-week course. Or another time that I'll honestly most commonly use repeat breath testing is when people, maybe we've done a few different rounds of treatment and they're still not better and they feel worse maybe, and then we retest to say, okay, what does our repeat test look like? Because honestly, in those patients, I actually see commonly that their breath test maybe looks significantly better, but they still don't feel any better. So then that makes me, again, go back to the drawing board and say, like, okay, what did I miss? Maybe it's yeast, maybe it's these other things that we just haven't addressed.
Yeah, it's so true. That's exactly how I approach it too, is that part of what we're looking at is the test result initially, like what are the levels, and part of it is what are your symptoms. And so after doing any course of treatment, whether you're doing the herbs or the Xifaxan, the antibiotics, or whether you're doing the elemental diet, it can bring those gas levels down pretty significantly. So I usually try to tell my patients, okay, based on your first test, I'm thinking you're going to need, maybe one, maybe two, sometimes even higher numbers of treatments before they're going to go to that zero level. But after someone does their treatment, whatever that is, we take stock and we say, like, are you 50% better? Are you 90% better? If you're 90% better and your diet's good and you're feeling really strong, there's no reason to spend the money on a test right now. Let's just see how you're doing. And so I approach it that same way. And it is confusing because sometimes I'll have patients who feel really good. We get the retest just to see what the numbers are looking like. And if they are higher, patients get really stressed about that. Like, what does that mean? What do I do with that? And in a way, just going off of their symptoms is going to make them feel better for longer. So I think that's a really good approach. And then what do you think about like spot methane testing? So remember, we're always testing with the SIBO, the hydrogen and the methane, and methane tends to be really sticky in the GI tract, and that's what tends to cause more constipation symptoms, although both of them can have some overlap there. But I always get a question about, like, when's the best time to just do a spot methane, and how accurate is that?
Yeah. So the beauty about the spot methane treatment is the person doesn't have to do the 1 day or 2 day prep diet. They don't have to drink the lactulose solution, right? So that tool can be really, really helpful. Again, what you mentioned, the spot methane, it's really only good for methane. So a person has to have a breath test, their initial breath test, their full breath test that has a high baseline methane. So, the first blow the person has needs to register as a high number. So we're thinking of like the teens or the 20s or the 30s or whatever else it is. So, the idea with that is we can't see what the methane level is maybe at its peak. The peak may have been at 80 minutes or 100 minutes, but we're able to say, okay, with the treatment we just did, your baseline was this, and now your baseline is lower or it's higher. And we're able to assess if our treatment is maybe a good treatment or not.
I think that makes so much sense. And I don't know, I'm sure you've run into this before, where sometimes you'll have a hydrogen level, so hydrogen and methane, and as the hydrogen goes down, the methane goes up, or there's like an unmasking process that happens. And that's really helpful information to get a spot methane test, because at that point you can see, okay, we've done some work, but now your methane is a little bit higher than it was before, which means it's been unmasked as we bring the hydrogen levels down. And so it's good to know then and reassess, where are we at in your treatment. So I see that a lot too. There's one other test that I run into sometimes, which is that Flatline Test. And it can indicate like a hydrogen sulfide picture. Talk to us about that. How is it different when you're interpreting the SIBO Lactulose results?
Yeah, so I would say with the hydrogen sulfide, like you mentioned, so again, we talked about methane and we talked about hydrogen gases, and hydrogen sulfide is neither of those, right? So when we have someone that maybe has overgrowth symptoms, bloating, gas, abdominal pain, mixed stools, whatever else it is, and they seem like, quacks like a duck, it looks like a duck, this looks like it's a SIBO case, and we do a breath test and it doesn't register either hydrogen or methane gases. And we commonly see that on the table or on the graph as what we call like a flat line, right? So maybe your hydrogen or methane never gets above a 2 or a 3 ever, right? So small intestine or large intestine. And we know the large intestine has, billions and trillions of bacteria. So it should be registering gas levels even in large intestine. So if it makes it that far and it's flat, hydrogen sulfide is a potential option.
Yeah. And how common would you say that is in your practice? I rarely see, I have a lot of questions about hydrogen sulfide, but most of the SIBO tests that I run are pretty like standard. There's some overgrowth of hydrogen or methane or both.
Yeah, and I was thinking about that. And so in my practice, I would agree with you, is very rare. And also, again, running this testing lab, I get test results from patients all over the country, right? So I'm probably running 20 or 30 breath tests a month, and I maybe see 0 to 1 a month out of all of those. So if that gives any kind of idea of how, I think it's relatively uncommon.
Yeah, I agree. I think that makes a lot of sense. And that flatline test is just so classic. Is there any other way to test for hydrogen sulfide bacteria, or how do you look at that and treat that?
Yeah, my understanding is it's there's not another great option with that, but you know, I think with SIBO, like my whole thing is I look at it like a three-legged stool, right? Does somebody have the symptoms that are associated with SIBO, all these things we just mentioned, bloating, gas, loose stool, whatever else it is? Do they have underlying risk factors for looking at SIBO, right? So antibiotic use, head injuries, all these different things we talk about, and do they have a positive breath test, right? So, you know, if we're looking at all those things and maybe then they have a flatline test, my next question usually actually goes back to symptoms. And I actually ask them, like, how do you do with sulfur containing foods? So how do you do with like Brussels sprouts and broccoli and cabbage and kale and all those kind of things, eggs, right? Does your gas smell really sulfury? And sometimes those are really good clues of, like, you know, usually you ask that question and they're like, yes, right? Like,
Yeah.
yes, my gas, it smells like rotten eggs. And then you're like, okay, I think that we have a better idea what's going on then.
That's so true. I feel like if you have that, you kind of know it. Your symptoms are really telling you. And I have had the occasional patient come in and say, "Oh, I've been on a sulfur-free diet for, X number of years, and that's the only thing that controls my symptoms." Well,
Hmm.
that's not typical, right? Like, you should be able, so many of these foods are really good for us. The brassicas are really high in sulfur. That's like Brussels sprouts, kale, chard, bok choy, all those amazing vegetables. And if you're not able to tolerate those, that's not always a typical thing. That could be an underlying hydrogen sulfide picture, or even yeast or regular SIBO can cause that to kind of get worse or move you into the symptom category.
Definitely.
So it's really helpful to know about. I think a lot of patients that I come across have been on a SIBO forum or have done a little bit of their own digging, but don't know very much about hydrogen sulfide as a possibility. So it's good to keep in the back of our mind, which as naturopaths, we're always trying to back up and see, like, what is that bigger picture? What else is missing from this?
Correct.
So is there anything else, just talking to the average person who maybe hasn't done a SIBO test, like, what does the prep diet look like, and what's the process of getting that test done?
Yeah. So honestly, one of the most common questions I get is, with especially a lot of my new patients, is like, okay, well, what kind of testing do I need to do before I come to see you? Or how much testing do I need to get done before I come see you? And my most common answer is none, right? Like, the first thing I want to do is sit down with you and talk about all the things that have been going on with you, right? Like, maybe SIBO isn't what's going on with you. Maybe it's something else that we need to address first, right? So that's usually the first place I start with a lot of people. And then, you know, if we decide to do a breath test, I walk them through and say, you know, it's a 1-day prep diet or a 2-day prep diet, and you're primarily just going to eat protein and rice. So, you know, if people eat eggs or they eat chicken, that's totally fine. Because the idea here is we're just trying to starve out, or, you know, not feed, I guess, the bacteria in the intestines, right? And then you're going to wake up the next morning. I tell them, don't smoke a pack of cigarettes, drink the
Don't do
lactulose.
that anyway.
Yeah, exactly. Just that day, though, it's most important. And then, you know, collect your breath every 20 minutes. And, you know, some people could do it at work. You know, you can eat normally afterwards. It's just a matter of setting a timer and just every 20 minutes collecting your breath. It's pretty straightforward. And even like on my website, on my business SIBO testing center, we have little videos to walk people through. It's pretty straightforward.
That is really helpful. I will make sure to definitely get your website linked to this as well when we post the video. And then what I often tell patients, do the prep diet on a Friday or a Saturday, and then just Netflix and chill the next morning on Sunday. You know, watch your movies and do your breath test, set your timer on your phone, and it's usually not a problem. I
Mhm.
have certainly had patients react to the lactulose, which doesn't surprise me because it's really giving a high dose of sugar to all those bugs that are moving in the GI. So what would you say to a patient that has symptoms taking the lactulose? How do they minimize those symptoms afterward, or what are some things they can do at home to help them feel better that day?
Yeah. So like we talked about earlier, I mean, that lactulose totally gobbles up, or is gobbled up by the bacteria, right? So it can produce all this gas and all these different symptoms. And, you know, in some patients, we'll actually use lactulose, but in a really high dose as a laxative. So for some people, it will cause diarrhea, right? We'll actually use it as a medication to cause diarrhea. So some people might cause loose stool too. So one thing that we can help with that is, after you're done eating, right? So eating a normal meal and kind of giving your intestines and everything, maybe some things to calm down. But maybe prior to that, taking a little bit of like activated charcoal or some sort of clay or some sort of binder, because that will be able to, you know, flush through the GI tract and bind up some of that lactulose and bind up some of that gas in the body, so that you're just able to, you know, absorb it or pass it out rather than just causing mayhem. But the important thing is making sure you're done with your testing before you start to do any of those things to decrease your symptoms.
Yeah, absolutely. And if you're getting a breath test, it has to be ordered by a physician. So just ask your doctor before you do the test, like, hey, is activated charcoal okay for me? Or bentonite clay is another binder that we talk about and use commonly for that. So just check in with your provider and make sure that that's okay to take afterward. And another thing I often recommend to patients, but you should always check in with your practitioner because they know you better. If you're my patient, then you can check in with me, of course. But I do fennel and chamomile, like a really strong concentrated chamomile and fennel tea, and just sip that through the day because those are carminative herbs, which means they move gas through the intestines. So it can be really calming and relieving for that lactulose solution after you drink it. So I love that too, but definitely we'll link to your videos because I know a lot of patients are stressed out about doing the test. Did I do it right? Did I blow in the right way? Did I do the prep diet? So those details are awesome that you have that on your website. And then I just have one more question too about the testing kind of preparation. I have a few patients that are vegan or vegetarian, and so that prep diet is really tough. Other than rice, what are some things that you recommend, or do you pretty much say like, this is just a fasting day and kind of, minimize what you're doing to prepare?
Yeah, I usually just have people do clear liquids for the day before. Just have them do a one day prep diet. Do the best you can. Maybe that's a day where, again, like if it's Saturday or whatever it is, and they can just lay in bed and watch movies all day. They wake up the next morning, take their breath test, and they can eat normally. So yeah, that's usually the best thing. Because the other thing too is we don't want people eating too much rice. So we don't want them just like filling themselves up on rice either. So so I usually just tell them like a clear fast, so it's a vegetable broth or teas or water or whatever else it is. And the nice thing is a lot of times why actually we use teas or use broth during fasts is that hot water curbs our appetite. So that hot liquid. So it's one of those things that it sounds scarier maybe than it is, and after you do it, you're like, okay, that wasn't all that bad.
Yeah, I agree. Minimizing the amount of time. So instead of doing a full 48 hours, a 24 hours is plenty of time. And then, yeah, just making yourself as comfortable as possible. But I agree. I think most patients are more scared of it than actually when they report back and say, oh, it really wasn't that bad. As long as you're not working a full day or it's not a really, really stressful day for you and you can minimize your obligations, that helps a lot too. Although sometimes distractions can be helpful at the same time. So moderate amount of distraction, I guess.
Exactly.
But is there anything else that you would, look out for that you wanted to mention before we sign off? I feel like this has been so helpful, just clarifying a few things and answering some of those really basic questions that my patients, always ask when we're talking about SIBO.
Yeah, I think the biggest thing that I would say is just be patient with yourself and be patient with your body, right? Everybody responds differently to treatment. Everyone's going to respond differently to different treatments. Oftentimes, it's accumulation of your life that's gotten people to the point where they just don't feel well, right? So, we can't always expect changes overnight, which is easier said than done. It's a process and it's a healing process. And, I've seen a lot of people get better. So, a lot of people feel doom and gloom coming into this, but, I would say that for the most part, and I'm sure you can agree, is that the majority of our people do get, most of their life back and get a lot of symptomatic improvement and feel significantly better when working with someone like us who's been trained and has the understanding of what to look at and how to treat the person in a very stepwise approach, so they can get long-term results from it.
Yeah, you're such a naturopath. You're like, oh yeah, we have to look at all the systems and we have to see what else is going on with you. It's like, it makes so much sense to me, but I think that's really like a revolutionary point for a lot of our patients. They come to naturopaths and are like, wait, you want to know about my sleep and my energy and my mood and what my history is? Like, how does that inform my care? So it was just, yeah, I think those are really good points. People do get better. I totally agree with you there. I've seen patients really turn, night and day in terms of their symptoms. And at the very least, I find that doing some work on SIBO makes their symptoms, 100% more manageable. So even for patients that have really sticky SIBO that we're doing some treatments, over the course of months or even a year or longer, that they get significant improvement enough so that they get their life back. And really that's what a lot of patients, they're at the end of the rope when they see us. Yep. So that's a really good reminder. People do feel better. And like I said, what I'll do is link to Dr. Holmes's website and put some resources up there for you guys if you have questions. And we collaborate with patients patients a lot. So there's, if I need a second opinion, I'll go to Dr. Holmes because I know he's doing this. This is his bread and butter every day. But please feel free to reach out, comment, send me your questions. You have my website link as well. And I just want to say a huge thank you to Dr. Holmes for just sharing all that information. I can't tell you how excited I was when he told me he got the SIBO breath test. I was like, great. Now I know exactly where to send all my tests, and I know they're going to be handled well. I know they're going to be accurate. And you're a doctor, you know exactly how to interpret it. So if I have any questions at all, I can go straight to you. So thank you for being that resource. And yeah, is there anything else you want to say before we go?
That's all I got. I appreciate being here today. This was fun.
Yeah, awesome. Thank you so much. Okay, we're going to sign off.